It. As we mentioned, there is an awful lot going on Capitol Hill. Of course, the discussions continue about the TARP and the use of that second tier of funds. Also, the issue is coming up of expanding the state children's health insurance program this week. Joining us now to talk about all of that is Javier Becerra. He's the Democrat from California who is the vice chair of the House Democratic Caucus, and Representative Marsha Blackburn, Republican from Tennessee, who is also the deputy whip. Nice to have you both with us. Thank you so much for joining us.
Thanks, Sue.
Representative Becerra, let me start with you. The SCHIP initiative, how, if indeed that is put through, how does that impact the overall Obama agenda to really kind of reform health care in this country? Does it have an impact? Does it not? How would it fit into the overall plan?
It has an impact beyond the issue of health care. First and foremost, to give 11 million children an opportunity to have access to a doctor or to a hospital is critical. And now, more than ever, with families losing their jobs and their homes, we can't afford to allow more kids to fall through those cracks of health care. And so when we talk about health care reform for President-elect Obama, it's not just extending it, it's making it possible for folks who are suffering through economic times to be able to hold on to a few things.
The previous price tag was $35 billion over 5 years to be paid for by taxes on things like cigarettes. Does that change? What do you anticipate this price tag would be?
Things have changed some because every year things become more expensive, and so we have to make sure that we adjust the bill so that it can adapt to today's times. But remember as well that this is part stimulus. If you keep a child able to go to a doctor or to a hospital, there is an economic impact in that regard. And so we know that not only will we help in terms of the health care of children, but in terms of helping the economy as well.
Steve?
Ms. Blackburn, I guess the definition of stimulus is being sort of greatly expanded these days. What is your take on whether or not that is actually stimulus, and overall the kind of stimulus ideas that are floating around? Actually, floating is too soft a word, I guess, landing like a ton of bricks on Congress these days.
Well, you're exactly right. And when we talk about the SCHIP bill, what you're talking about is expanding taxes on the middle class, whether that is done through health care taxes or whether it is done through tobacco taxes. There has to be a pay-for at some point in time. Now, when we look at the overall stimulus package, what we know is Plan A, the Paulson plan, didn't work. And now we know that there were not the appropriate guidelines, if you will. There were not the accountabilities in place that will tell people whether or not that did work or how well it worked. So now they're talking about Plan B, which is the Obama stimulus, and they've lumped SCHIP into this. And you're talking about taking a $10.7 trillion debt, which is where we were as of January 3rd, and you're talking about adding on top of that. At some point, we are going to get to the point where we're already going to be at 52% of GDP for our debt if Obama pushes his stimulus. That's historic levels.
I want to
so
understand
where do we
something.
hit the tipping point?